So next up, we're happy to have Dr. Christian Goulet from Ottawa and CHEO going to be giving us a talk on pediatric concussion, and looking forward to it. Thank you very much.
All right, thank you for Dr. Dilworth and inviting me down here to give us a chat. I hope people are here to listen to a talk on acute concussions. I don't see acute concussions anymore. I see the ones that nobody else wants to see that have been out of school for a year and chronic pain patients. So, but I figured sports medicine doctors here, you're going to kind of get the gist of that one. So I've given this talk probably 100 times, right? A lot of different groups. So you can get a feel to who you're presenting to. I think I've given this talk to a lot of psychiatrists, where there's a lot of cardigans and beards, and there's normally somebody with a pipe in the audience, right? And I've given it to family doctors, so there's a lot of Patagonia out there too. And I give it to pediatricians, everybody's so bubbly and happy, right? And I've given this talk to neurologists, and they're all kind of cantankerous and condescending, right? But sports medicine, right? You know, you're talking about your sports medicine doctors is when everybody in the audience is incredibly fit, right? So lesson number one for me, if you want to get invited back, you suck up to your audience, right? All right, so this is the title that I came up with. I've given lots of different versions of this talk over the years. Not a perfect title, but there's some alliteration in there, so I thought it was kind of catchy, right? Now, a lot of people, a lot of sports teams here, so my wife doesn't let me attend sports events anymore, right? But I am involved in this other pretty cool team. It's the International Health Advisory Team, and if anybody wants to talk about it afterwards, I was fortunate down to DC a few years ago, almost first Trump administration, but so down and worked with the CIA about this thing called Havana syndrome. So really cool experience I'm happy to talk about. But anyway, I digress. So I didn't think there was ever a perfect, real kind of headline for a talk until I came across this headline. And I'm like, whoever wrote this headline is a genius, right? So I figured, all right, I can kind of redo my headline, my talk here. And so if I were to redo this, the title for this talk would be Managing Pediatric Concussions in 2025. The Effect on the Brain and the Mind. So at the University of Ottawa, I work at the Brain and Mind Research Institute, and it's a very important distinction that I like to make because the brain and the mind are very different things, right? The brain's the hardware, the mind's the software, the brain's the phone, the mind are the apps. They work together, but they're very, very different. And what this talk really is about this prolonged imbalance between our amygdala, right, our stress response, and our prefrontal cortex. And those are the kids that I see, these chronic cases. It's really a discrepancy in that balance. And then more recently, I think people can, if you do treat kids, you can see that, pediatrics has really changed over the last few years. And a lot of the talks that I do now is actually the mental health implications of digital technology. And hopefully we'll get to a point where we can talk about how to treat these things. So disclosures, I think just knowing the ambience here, I should disclose I am part of House Hufflepuff, right? Given the Harry Potter kind of theme here. But this talk used to be 240 slides, right? Full disclosure, I thought it was an hour talk until my training down here. So even at an hour, it was going to be kind of tight. This is going to be the Reader's Digest version of the Reader's Digest version. I've probably seen 10,000 concussions in my life. And the way that I manage them now are very, very different than 15 years ago. And I think, 5, 6, 7 years ago, 6, 7, right? Sorry, 6, 7. But I started seeing concussions really change, right? Like I used to see one patient, a month that wasn't getting better, right? Within a reasonable time to like getting at one point like 10 referrals a day about these kids just falling apart. And then I started seeing these other kids that, came in with chronic fatigue and chronic pain and headaches and cognitive, blurring and they never hit their head. But they go, I got a concussion, 8 years ago. So I think, my headache started 3 weeks ago. It's probably from that, right? So it's changed. And then I started seeing my other pediatric practice. So I do, a lot of general ped stuff as well. But my practice really changed, focusing solely on kind of the brain and the mind and dysfunction within that. And so I do say that this is kind of a weird talk, so you have to bear with me. It's not necessarily about concussions, but hopefully you can kind of take this lens and learn from the many lessons that I've learned about how we got to change treating pediatrics, not just pediatric concussions. And I'm equally biased. I do tons of talks for all sorts of different places. All right, so I do have a lot of these kind of pictures up here, so I'm not going to try to confirm the accuracy of who they are attributed to. All right, so the objectives of this talk. So I'm going to talk about the 4 major determinants that influence concussion recovery. I'm going to explain how and why concussions are more than just the injury to the brain that happens, right? You have to look at it as a trauma, right? And then the resulting stress response that occurs, right? I'm going to hopefully talk about a systemic way to manage kids with persistent symptoms after concussions or persistent post-concussion symptoms. I'm going to quickly talk about why technology is so bad for the developing brain. And I'm hopefully going to get through about 90% of this talk before Dilworth comes up here and cuts off my mic, right? So there's a lot of content we got to get through. Oh, so how did that get in there too? Sorry. All right, there we go. So because I waste a lot of time, I always ask audiences to give me some Transformers, not the 80s cartoon, but to talk to me about books that have really either changed their outlook on life, changed their outlook on practice, right? And these are a few of my favorite ones here. And I think one of the most revelatory books that I read years ago, The Body Keeps the Score by Bessel van der Kolk, one of the greatest books linking trauma in the body, in the mind, in the brain. It's a wonderful read, and it's like everything else, it's on Audible. All right. So a couple of things to consider with the head injury. Hippocrates is quoted as saying, head injury is too trivial to ignore. And you don't need to be Einstein to know that concussions are bad for your brain. And in fact, I'm working with Hockey Canada right now, and we're actually very, very close. Hopefully nobody boos me here, but we're very close at pushing the age of body contact from 13 to 15, right? And so hopefully next year at this time, if Alberta kind of gets their act together, there'll be a big change in body contact age for Hockey Canada. Carolyn Emily, yeah. So she's on that committee too. Yeah. But the other thing to remember is that our brains are inherently strong, right? So even the Pope says evolution is real, right? So our ancestors made a living about getting concussions, right? So there's definitely something going on, because this is a classic patient that I'll see. I think you guys can all kind of sympathize with me. Really impressive 14-year-old, right? Provincial level volleyball player, IB program, level 9 pianist, wants to be a neurosurgeon, right? Just a very innocuous kind of hit to the head, right? A volleyball, or turned her head into a shelf, right? And then comes to see me 3, 6, 12 months later and is not full-time school. Can't get up without, getting dizzy, right? Can you imagine our ancestors in those caves if they got hit with a volleyball and then, 6 months later they couldn't stand up, right? So this is the patients that I see, right? And so it took me a while to understand that there's something else going on. And so what is it? So this talk is more about why concussion symptoms don't get better. As you know, one of the definitions of concussions is they should get better progressively, sequentially, right? I haven't seen one of those in about 12 years, right? So if they're not getting better progressively, sequentially, you got to start looking for something else, right? By definition, right? So our brain, it is engineered for trauma, right? We got hit with rocks and sticks and all sorts of different things, but our brain and our mind is very bad at recovering from head injury and trauma in this world, right? And this is why I'm really pushing Hockey Canada. It's not so much that concussions are terrible for the brain, but they are traumatic. And any trauma that a kid is inflicted upon, if you look at the adverse childhood events, like any trauma on a developing brain is bad, whether it's a physical trauma or an emotional trauma. What happens to the body is actually very, very similar. All right, and it really does come down to this imbalance between the prefrontal cortex and my buddy, the amygdala, right? So it's a little bit about the brain, right? Our brain hasn't changed very much in 50,000 years, right? Fact, right? But just think about how much the world has changed, the last 50 years, right? Completely different. Same thing with the mind, right? Our minds, the working part of the brain here, has this negativity bias, right? Our mind is always scouring the environment for negative things, and that was okay if, you lived with 12 people and there was an saber-toothed tiger, right? But when you have work and school and mortgages and the internet, right, there's no shortage of negative things for our brain to latch onto. And then our brain likes to learn, right? We have that stimulation bias, right? Which again is good when we were following animals and huddling around fires, but when we have something in our hand that has more stimulation in it and more dopamine in it than our ancestors would have seen in a lifetime combined, that is a problem. So a lot of what I talk is about, digital tech, but why are kids not getting better? And part of it is, the world is a lot different. And there's another good book too called, by Jonathan Haidt, called The Coddling of the American Mind, right? Very, very good book about, and it's about, it's good to scrape our knees, right? You can break the odd bone, right? Not the bubble wrap culture, I think that we've kind of adopted here, where, you can't hurt your feelings, you can't hear somebody else's view. So, this protectionism, I think, has really limited how our kids have started to develop. All right, so one of the things about tech is that, we laugh at these, the 1950s, right? And they had these cigarette machines, right? Vending machines with cigarettes in them. Anybody could get them, and we laughed at those people. But the next generation, it will laugh at us because we had TV shows designed for babies, right? Literally, we thought TV shows would make your baby smarter, right? And then we thought it was cute when our 2.5-year-old could open our iPhone, right? How much we ignored our kids, right? And again, I always do this. I was talking to you this morning on the way in, like, you go to a fast food restaurant, look behind you, everybody's looking at their phones, right? And if you're a guy and you're in the washroom, right, going pee, if you can't pee without looking at your phone, there is a problem, right? And we are actually seeing evolution in real time, right? This technique is a thing, and there's actually these little occipital bone protrusions that are happening on the occiput of some kids, right? All right, so again, I'll see 30 to 40 kids a day, right? And it's never about sore throats and constipation really anymore. It's all about, chronic pain amplification. It's these, fibromyalgia, chronic fatigue syndrome. I'm seeing kids with chronic fatigue syndrome, right? That used to take 40 years, 50 years for that kind of inflammation to develop. And now we're seeing it in 15. And so what the concussion world allowed me to do, it kind of allowed getting me a glimpse of what's going on with these rest of these kids, right? In terms of the trauma and the overstimulated of the mind. And, I work with some universities as well too, and they're having a hard time now keeping up with all the IEPs that, we have for anxiety, right? Like, these are going to be paying our pensions when we're older, these people, right? And they need accommodations for everything. It's we're in a little bit of trouble here. All right, part one, the head injury itself. All right. So what I say about head injuries, right? It's nothing so well studied, but so poorly agreed upon. I think everybody has different opinions on this. But concussion is a world of dichotomies, right? You have your conscious versus your subconscious. You have your amygdala versus your prefrontal cortex, the brain versus the mind, and then you kind of have those extremists, right? So people that don't think you should play sports because you've had 2 concussions, right? Or the deniers that, you get a concussion and throw some dirt on it. So thankfully, that I think we're finding that happy ground a little bit. I think, 5-6 years ago, we got a little bit carried away. But certainly we don't want to treat head injuries like we did 20 years ago. So I think we're starting to find a little bit of better balance. All right. So just when we talk about concussions, there's a couple of things, apples and oranges, right? All sorts of different fruits. There's big differences when we talk about acute concussions, persistent concussions, this magical, mythical, poorly understood, but highly publicized chronic traumatic encephalopathy, second impact syndrome, and moderate to severe brain. These are all very different things, different pathophysiologies behind them. So what I'm going to be talking mostly about is the acute concussion, but even more so those persistent symptoms. So what is a concussion? Well, you get a lot of people, and you're going to know this definition, right? This is by the sports group there. But I'm going to highlight just concussions should get better progressively and sequentially, right? And so this is what I want to talk about here in a second. Now, my definition, right, of concussion is any mental status change following trauma that cannot be attributed to extracranial factors or a pre-existing or comorbid condition. And just because symptoms are present after a head injury that weren't there before doesn't mean that they are still concussed. And you really got to look at all these different kind of factors. Can you read those little quotes? Not so much. All right, so approaching a concussed patient, right? So with kids, as in everything else, right, there's a lot of pieces to the puzzle, right? But for me, when I deal with concussions, I really go to not so much the mechanism of injury or loss of consciousness, amnesia. I'm like, all right, what's the balance between their cortex, their prefrontal cortex, and their amygdala? And I explained the amygdala, right? And this is one of the analogies that I use a lot. Our amygdala, if you go back to med school, remember, it's kind of like our spidey sense, right? Like this amygdala is kind of in the background looking for something to worry about, right? But the human spidey sense needs to be recalibrated, right? Like my amygdala turns on when I'm running late in clinic, right? And the amygdala should only be engaged when there's a true danger there, right? And I run late all the time, and I've only once been attacked by a patient for running late, right? So I don't need this fight or flight response that happens, right? And yet, boom, without any conscious control, I'm running late, and I start dumping all this adrenaline and cortisol, and it causes a change in me physically and a change in me mentally, right? And those changes used to help us stay alive 50,000 years ago, but now not so good. All right, so just a little bit of a primer here. So the prefrontal cortex, right? Front part of the brain helps us do the right thing when the right thing is the harder thing to do. Listen to boring doctors talk, clean your room, empty the dishwasher, right? Sit on your bum for 6 to 8 hours a day. It does grow until you're 25 years old, right? And so this imbalance, this underdeveloped prefrontal cortex is a lot of times why teenagers are, if you read the literature, teenagers are, as an age population, most likely to develop post-concussion, persistent post-concussion symptoms, right? And then ADHD kids are even harder to treat, right? Because on average, kids with ADHD are smarter than kids without ADHD. It's just their prefrontal cortex is 2 to 4 years slower, right? So they have a worse functioning, right, prefrontal cortex, and they don't follow instructions anyway, right? And so we do know that with head injury, the prefrontal cortex is shut down, right? We'll explain why that is in a couple of minutes, right? And really, I see the prefrontal cortex, it's kind of like that angel, you know those old 80 cartoons, right? You got that angel on the shoulder here, right? Trying to get you to do the good thing, and then you got the devil on the other, right? That's the amygdala versus the prefrontal cortex. So the amygdala, right? I'm gonna fly through this here too, but it is a major player in our fight or flight response. The right middle lobe, right? Specifically, the right middle lobe is activated with the rotation of the head, right? I.e. the concussion. So without any conscious control, your head rotates a lot, you get a quote-unquote concussion, your amygdala goes into overdrive. And that's because you wanted your amygdala to turn on 10,000 years ago. You got a concussion 10,000 years ago, it's likely something trying to kill you. You get a concussion now, chances are you're not being chased by a saber-toothed tiger. And yet our body and our brain responds in the same way as if we were, right? And what's taught me, doing this for 10 years, if we cannot control that stress response in kids, they will never get better. All right, so you kind of heard a little bit of a theme for the day. So we always say this, right? So pediatric patients, we're not just little adults, a lot of different challenges, right? So we know that teenagers are most likely to get persistent symptoms after concussions, but we do know that like young kids actually learning how to skate in the hockey world, those little tidbits and they're skating around and falling, they actually have the neurological changes that are associated with concussion quite often. And the kids too, it's a tough time in their life, right? With all the different competing interests, right? Their gender identity issues, they're trying to find what they're good at, they're trying to find a good tribe to hang out with, right? Their parents don't understand them, right? And there's just lots of different stressors, and everybody has stressors, but teenagers are at increased risk because there's so much stress and that lack of prefrontal cortex, right? So again, I don't want to belabor this, but again, there are lots of difference between pediatric patients and adults, right? That developing brain, the neck strength, right? Hormones are surging. I got 2 teenage daughters at my house, so I can attest to that for some. Are they hormonal, or is this kind of like a concussion that they have, right? But they got school duties, they got part-time jobs and sports and very poor coping strategies. And teens, that is that second impact. And this is where everybody's waving their hands for so much about second impact syndrome, and you can't go back if you get hit. So we were cocooning people for so long, and that would just make them worse. But second impact is still a thing. I work a lot with the Stringer family about with Rowan's day and how she died. But that was an expensive case. She had rip-roaring concussion symptoms, probably back-to-back concussions. She went back in a rugby tournament, had another one, and then she died. That's very, very different than the soft kind of concussion symptoms that we'll often see in clinic, but you do have to respect it. All right, so whenever I deal with an acute concussion, right, so I kind of break it down into these 4 contributing factors. You have this, quote-unquote, the concussion itself, right? You have the extracranial factors, so you can have a head injury, right, that also involves a neck injury, or it can involve the jaw, the eyes, the inner ear, something like that. Then you have all these other things, and this is why I'm always running late, is because there's lots of things that are going to influence our concussion recovery that either can come from a head injury or not. And then you have kind of my baby here, right? What I call this antiquated post-trauma neuroinflammatory response. It sounds very, very clever, but I made it up, so it's not that clever, right? And this is kind of what I feel like, right, at the end of these days, right? All right, so when you have a head injury and you say you're concussed, what you're doing is you're referring to the chemical imbalance, right, that happens within the neurons of the brain. And when I see kids for a concussion, I'll draw this out, right? And I'll tell them my autistic ability peaked when I was about 3 years old, right? But this is a concussion, right? And I'll draw it out. It's potassium, it's sodium, it's lactic acid, it's glutamate, it's all these different chemicals going on here. And then I show it to them. I say, this chicken scratch, this is what you did to your brain, right? Now there's good news, bad news, right? The bad news is you waited 6 months to get in to see me, and I can't give you anything to fix this, right? And nobody can. Someone tries to sell you it, don't buy it, right? But the good news is, from the second you got concussed, your brain has started to try to fix it. It does. As soon as you get concussed, right, your brain starts to plug those holes, right, in those neuron membranes. It starts pulling that potassium back into the cell, pushing the sodium out, getting rid of the calcium, right? Get rid of the calcium, the neurons will shrink. The neurons will shrink, the pressure should go away in your headache, and without that calcium in there, your mitochondria, right, that powerhouse of the cell will start making energy, so you get energy, get rid of the glutamate, get rid of the lactate, and you're on your way. And that's why concussion should get better progressively and sequentially following that model, right? So concussion symptoms shouldn't just stick because your brain keeps trying to fix it, right? Concussion symptoms shouldn't get worse, not a lot anyway, unless you re-hit yourself, right? So yeah, you might overexert and it might spike a little bit, but then your brain will just go back fixing it, right? And concussion symptoms definitely shouldn't have these huge fluctuations. You're okay for a day, and then the next day you're not, right? That's not how the chemistry works. So then they're kind of looking at me, and it's not going very well because they identify themselves as a concussion, right? They don't know I'm going with this, or a concussion patient, and what am I doing? And I'm saying, well, all right. So maybe your symptoms did come from your head injury. They're not concussion, but maybe they came from the head injury, right? These are just some other examples here. So yeah, maybe as part of this, you got your, maybe you got a little bit whiplash, right? Maybe a little TMJ dysfunction, right? Maybe there's a vestibular ocular reflex thing going on, right? And then I tell them, it's my job to kind of figure out if this is a problem for you, because my wallet doesn't get any thicker, right? If I think you have some whiplash, right? But saying that too, I don't think I would have ever healed, quote unquote healed, anybody without some good allied health professionals. I think they are absolutely imperative, and we got to work in lockstep with them. And then there's other complicating issues, right? So after a month, I have a very, very low threshold of getting blood work on kids, and sometimes just the threat of getting blood work helps with their recovery quite a bit, right? But these are all different things that I've seen, right? I've diagnosed with kids coming to me with concussions, right? Lyme disease, I've seen, arthritis, right? I had one 18-year-old that had MS, right? Inflammatory bowel, celiac, all these different things, right? So this is why it's really imperative that medical doctors are involved, because I know there's a lot of push that, do you need MDs for this? Absolutely, you do. And then this is the post-trauma neuroinflammatory response. So what really happens, I think, with concussions that causes these prolonged symptoms is you get this hyperactive amygdala, right? And this is, sometimes I'll talk for 20, 30 minutes on this slide, but this is what I explain to the patients. I kind of explain this is the mind, right? So think if we moved on from the brain, I talked about the brain, this is the mind, so how the brain works. This is actually from Hans Selye. He was a McGill guy there, and he posted this in 1932. He was the first one in like 2,000 years that really linked the mind, right, and the body together, right? And I explained this to kids, right? Said, to get you better from your head injury, you got to be in this quote-unquote green zone, right? This is when you're thinking with that front part of your brain, prefrontal cortex. That means, there's no stress response. It means, your pain's well controlled. It means that you like school and school likes you, and you like home and home likes you, and you're eating well and sleeping well and getting good exercise, and not thinking about tomorrow, not thinking about yesterday, you're not trying to please everybody, you're just kind of like Buddha, you're calm, right? Well, I never see people in the green zone. The yellow zone, right? So the yellow zone, this is the trigger. This is the thing that turns on your spidey sense. This is the thing that puts you into that fight or flight that's only supposed to be a true threat to your survival, not running late like me or being told, turn your video games off, or even going to school. Like all the kids that I'm seeing that refuse to go to school, right? But it doesn't matter. Your amygdala doesn't like it. Faster than you can see, you go into this orange zone, which is going to be, all right, let's just stay alive. Let's dump all these chemicals in our body, and let's just stay alive. And you're only supposed to be in that orange zone for 30 minutes at a time. The chemicals that your amygdala triggers are hard on the body that cause inflammation, right? But we have evolved to withstand that level of inflammation about 30 minutes at a time. That's because fights can last more than 30 minutes, right? If you ran 30 minutes, 5 kilometers away, you're probably far enough. But the chemicals, the noradrenaline, the cortisol that you secrete cause inflammation on the body, and then that red phase is burnout. And this burnout is chronic fatigue syndrome, it's fibromyalgia, it's quote unquote post-concussion syndrome, it's depression. Your body literally gets burnt out. Now, Hans Selye made a lot of mistakes in this, right? And it was funny how he kind of came across this, but he did believe in this thing called adrenal fatigue, which does not exist, right? But you can burn out, right? And this is all the disability that we're seeing. All right. Part 2, head injury and stress. If you're looking for a good kind of primer on the stress response that comes from head injury, this is it here. And you have access to these slides as well, too. I don't want to information dump on you, but we're running low on time already. But like we said before, right, traumatic brain injury, it's that right middle lobe. And one of the most fascinating studies that I read, guys, and I couldn't find it, must have been unpublished data, but if you give, so they took these rats, right, this one rat, and they genetically cloned it, right, and they broke this group of genetically identical rats, and they broke it into 2 different groups, right, and the one group, both rats, they gave the exact same head injury. So they dropped the same weight from the same height at the same angle, hit those 4 rats in the same part. So the genetically, the mouse was the same, right? The head injury was the same. The only variable that they changed in these 2 groups is that one group of rats, they kept doing that foot shock stress test. So they never allowed the stress response to turn off. They kept shocking them, right? And then the other group, they didn't do that. Those genetically identical rats with the same injury, the ones that had the foot shock stress test eventually died, and then the other rats got better within 2 to 3 days, right? Which is equal to about 2 to 3 weeks in our lifespan, right? So incredibly fascinating. I've been looking for it, but I remember reading it. It's probably somewhere in my cloud somewhere, but I don't know if I one of the best studies I've ever seen. All right. So again, lots of amygdala activation is not good. Now, when you think about the concussion, just humor me here, guys. When you have concussion symptoms, right? Because I can say stuff like this because nobody can really prove me wrong, so it's kind of nice, right? But when you think of acute concussion symptoms, think, all right, could these symptoms be due to the potassium, the sodium, the glutamate, right? Maybe the change in cerebrovascular blood flow, a little bit that comes with the head injury? Or could it be due to this kind of maladapted stress response, right? I want to go through this with you here. And people present in different ways. You have the fight, flight, freeze, faint, tend, and befriend kind of way to survive. Different people, different things, right? But all right, so think of concussion symptoms, especially the long-standing people. All right, so you get a head injury, they'll look in your pupils, right? And they're not looking to see if you have a raised, well, they are trying to see if you have raised intracranial pressure, right? But it's not the concussion, it's not the sodium, potassium, glutamate that makes your pupils dilate. It's your amygdala. Anytime your amygdala activates, your pupils get big. And that's because, remember, the amygdala is turned on when you are in a life or death situation. And throughout human history, that was more often at night. So those of us whose pupils got big when we got concussed or our amygdala turned on, we were more likely to stay alive, but then we had lights, right? So concussions, that sodium, potassium, they don't give you light sensitivity, they don't. But activation of the amygdala that we know happens from a head trauma, right, does dilate the pupil, which gives you your light sensitivity, right? Now, some people with concussions, it's not light, but it's hearing. It's the same reason, right? If there's dangers around, you want to try to hear for that saber-toothed tiger creeping through the grass. But when our amygdala enhances our sense of hearing, right? We have 8 billion people in the world, right? We have, 30 kids jammed in classrooms, devices with volume buttons on them, right? That's where the hearing sensitivity comes in. And the problem with the amygdala, it lights up not only if you break your leg or you have a concussion or if you're stressed out, right? But it also lights up when everything is different, right? So, because different, 20,000 years ago was a bad thing. So this has actually been shown in some studies, is when the amygdala is perceiving too much light, too much sound, that's disconcerting to our amygdala. So it keeps secreting adrenaline and cortisol, it keeps your pupils a little bit more dilated, keeps your adrenaline a little bit more. So this is part of the cycle. And what you'll see with concussions, it's all about the cycle. Same thing, muscles, right? So when the amygdala turns on, it diverts all of our body's energy to our muscles, so we can either fight that saber-tooth tiger or run away, right? But this is why when I'm running late in clinic, I'm sitting on my little stool, my foot starts shaking, right? But this is why kids bite their nails, they pick, they scratch, right? They just have all this energy in them, right? Because the amygdala is turned on, right? And we even showed at my Cheeto clinic years ago that when the amygdala is turned on, humans are more likely to turn what we call this en bloc posturing, as opposed to like this. So this is where a lot of that neck tension comes from, right? And the back tension, right? And obviously that can come with, some headaches if you have some chronic techniques. So is it whiplash or is it just this chronic muscle activation? Now, my favorite ADHD person, Albert Einstein, right? He taught us that energy in the universe is not created or destroyed. So what your body does to get that energy to the muscles, it actually constricts, right? The blood going to your brain just a wee little bit, right? To get some of that energy to the muscles. But our brain is very particular on how much blood it gets, about 1 liter a minute, right? So when you start changing that, especially if you're a little dehydrated, your iron's a little bit low, well, you're gonna get dizzy. And it's the rebound. So it's when the amygdala turns off, right? So you get through your big test, you get through the traffic, you do a presentation where your presentation is gonna run long. Once you write that and you relax, those blood vessels dilate, you get a surge of blood to your brain, which is why quote unquote stress is the #1 cause of headaches, right? It's not a psychological thing, it's a psychological leading to the physiologic. And then the other reason, right? So we have that big vagal nerve. So there's a lot of thick nerve connections going from our amygdala to our vagal nerve. So vagal is Latin for wandering, goes from the back of the brain down to the belly, right? So we don't need to be digesting food when we are being chased by a saber-toothed tiger, right? So in the concussion world, this is where you get a lot of nausea and eating issues from, but this is in the peds world, why 70% of abdominal pain in kids, we don't find out the cause, right? When kids do get sent to me for abdominal pain, say, listen, we're gonna cost the government a lot of money. We will. We're gonna do poop samples and blood samples. We'll do some imaging, right? But at the end of the day, there's a 7 to 8% chance we are not going to fight it, but your pain is real. It just doesn't come from your liver, your spleen. It comes from a nerve that's shooting down almost like a headache would. If you are in your, so 20,000 years ago, if you are in your cave and there's something dangerous outside of your cave, so your amygdala is turned on, you are not going to sleep, right? Or this is why kids like to sleep with their mom and their dad, right? They're the most kind of safe place you can be. But that alertness in our world leads to insomnia. And 85% of concussion symptoms at the 3-month mark are better explained by sleep problems than they are to any remote head injury. There was a study by Rao in 2015, right? But the other thing is you go from being, remember that amygdala is only supposed to be turned on for 30 minutes, right? More than 30 minutes, this is where people burn out, they get fatigued. So you go from not being able to sleep just to be tired all the time. And then the other thing, right? This is why, all those drug companies pay me to do these talks, because I talk about prefrontal cortex, right? Kids with ADHD smarter than kids without, it's just their prefrontal cortex, remember, 2 to 4 years slower to grow, right? Well, if there's something dangerous around, you want to have ADHD, you want to be distracted, you want to be impulsive, you want to be able to react without thinking. So I do not have ADHD. My wife thinks that I do, right? But I'm pretty sure that I don't. But when I'm running late, you would swear to God I have ADHD, right? Because the amygdala turns on, the prefrontal cortex actually shuts down. So a lot of my days I see, these kids that have terrible school issues, right? But is it ADHD? Is it anxiety? Is it past trauma? Is it too much screen time? Who knows? All right, so you think about this kind of, the cycling we talked. So not only does your amygdala perceive too much light and too much sound, it causes cycling, right? But think about this, like you get a concussion, your prefrontal cortex shuts down, well, that's gonna make school cause some problems, right? School's not going really well, that's gonna cause some sleep problems. You're not sleeping really well, you're more likely to have headaches. You're having headaches, that's gonna cause more problems with your mood. Your mood's struggling, while your social relationships are gonna struggle. Social relationships are struggling, while your sleep's gonna struggle. Your sleep's gonna struggle, your school's gonna struggle. And you get caught in these cycles, right? And everything's just a cycle. And what they've shown in rat models, cerebrospinal fluid, that when you get caught in these perpetual stress cycles, you actually lose active levels of noradrenaline, dopamine, and serotonin. So this is where you see all these mental health issues come from. It's not necessarily because the head rotated, it's because you get caught in those cycles and you lose your dopamine, your noradrenaline even. You get caught in those stress cycles, your hippocampus shrinks, right? So your memory from short-term to long-term spatial memory gets worse, right? Your prefrontal cortex further shuts down, and your amygdala gets bigger. The more adrenaline, more cortisol you're screaming, so you become more reactionary. So you get the chemical problems, you get the brain problems, right? And that's where we are. Now, again, if you're looking for some good studies, chronic stress in the brain and what it does, and the neuroplasticity, both negative and positive, right? All right, so part 3. This is what I really want to talk about is the people that don't get better from head injury, they're the ones that just can't get out of that orange phase. They can't turn that amygdala off. You perpetually, like just think of any one of us. If we have a long day at work, right? Long day at work, we're stressed, we're go, 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 go all the time. How do we feel at the end of the day? Burnt out, right? We feel like we have post-concussion syndrome for that matter, right? But most of us hopefully wake up in the morning feeling somewhat relatively refreshed. Now, there's something called the 2-hit hypothesis, or priming the inflammatory pump in the concussion world, which basically states, right, the people that don't get better, oh, you can't see my little mouse there. This makes no sense to you then. So the kids that are in this orange zone here, right, their body is primed, right? So there's a little bit of cellular inflammation going on. They have higher levels of interleukin 4, 6, and 10. This has all been shown, right? So their brain is primed. There's a little bit of this trauma response, and they get hit. They don't go from that nice, calm, green phase to slightly elevated. They go from a primed state to amplified. And this is where people are getting all these huge symptoms, and I could tell you a million stories, right? I had one kid not long ago, he's a football player, played high-level football. His father passed away. He went back to football just like a week and a half later, and he took this mild hit to the head, right? Just someone bumped him on the back of the head, and he started seizing on the field, right? So his brain, this trauma was set in, and it just exploded on him from a little trauma. All right, so if you're looking, and my argument, guys, is tech is doing this, right? And I could talk to you for an hour about the changes. Within 1 week of heavy screen use, our brain starts to rewire. It starts to change, right? And those changes that happen are not good, right? And if you're looking for some books about, tech and helping your kids, right? Reset Your Child's Brain is a pretty good one, but my favorite is The Anxious Generation. I think every parent should read this book, right? It talks a little bit about coddling, but a lot about what digital tech does. And I put this slide here, knowing that I don't have a lot of time, but so you guys can all laugh at me because I spent literally about 4 hours trying to make this slide here on the right, these little squiggly lines. And basically what it was supposed to represent is 10 to 18%. These are the kids that, had these chronic symptoms, chronic concussions or depression, anxiety, and this was throughout human history. It ranged from 10 to 18%. The squiggly line is when the iPhone, right, 2010 was introduced. And then about 2 years after that, we saw all these things start spiking, right? And I made this, all I had to do was wait about 6 years, and then this is what the Anxious Generation gave. You'll see these different, and you'll get the slides for this. I don't have time to go over it, but that gray zone is the introduction of the iPhone, handheld technology, very different than computers and watching TV, handheld technology. But you'll see how life is changing. Now, that second slide, the second picture on the bottom, that's how quickly everybody got cell phones, right? So if you look back at the first squiggly line, this is how long it took. It took like 20, 25 years for everybody to get radios. Right? And then the far line, that's smartphones. Everybody got a cell phone. Our kids got a cell phone. We didn't know what was going on. We didn't know the dangers of the technology. Everybody's got them, right? And now we're starting to realize, oh crap, right? Maybe it's not good that my kid plays 6 hours of Fortnite every day. All right, and then this is just more, guys. I don't have a lot of time to talk about it because there's something else that I want to talk about. Do I have any time left or no? Sure. I said, the guy behind you was shaking his head, no. All right, so, okay, in 1 minute, right, how do we manage these things? Well, again, just some pearls. If you're at an event, make sure that it's the A, B's, and C's first, right? Oh, thank you, I'm sweating buckets up here. But also a head injury is a neck injury until proven otherwise, right? During my ER shifts too, I remember some people that had some pretty significant head injury and nobody cleared their C-spine, right? So remember that. Don't CT people in the head, right? Please don't, unless you're really, really, really sure. And thankfully, there are things to make us really, really, really sure if you want to CT a kid's head. So there are these guidelines, right? So children less than 2, older than 2, right? CT is very bad. Take a good history, really focusing on what's going on in their life, right? Their stress, their anxiety, how much screen time they have, watch the over-medication headaches, right? These are all things that I don't have time to go through. But one of the biggest things as physicians, you got to paint a positive picture for concussions, right? You know, kids will often hear about their gym teacher that had 6 years worth of symptoms, and if you think that you are not going to recover well, you are not going to recover well. And so I'm going to kind of just go through my 3 Ps. So this is how I help those chronic cases, whether they're concussions or whether there's, whether they're, anxiety, depression. We try to develop resiliency, growth mindset in our kids. I know it's a buzzword, but it's so incredibly important, right? To get your kids as healthy mentally, physically, the screens have got to go, right? You don't see any marathon runners smoking cigarettes, and I tell patients, right, if somebody has asthma and they're smoking cigarettes, there's nothing that anybody can do to help them, right? And the same thing, if you have anxiety, you have concussion, you have ADHD, and your screen time is out of control, the structural changes that happen to your brain from the digital tech are not, it's just making it impossible to help. So at 1 month, I do get the blood work, right? And then they'll come and see me 4 to 6 weeks later if they're not better. I do use the off-label use of amitriptyline, good for headaches, because you can't be in the green zone if you're having headaches all the time, and it helps you sleep. You can't be in the green zone if you're not sleeping well. So amitriptyline, if they're very sensitive, nortriptyline. Yeah, you guys know about MRIs. And I think, guys, again, I'm going to just end it here. It's just to stay on relative good time. So sorry for not getting to everything.
Christian, just to clarify, that's a 1 month follow-up from when you see them.
Well, I see, yeah. So if they do everything I said, we have blood work back, and they're still not better, and they went on, like, we hijacked the migraine literature, right? So I use magnesium when I first see them. I'll use coenzyme Q10, B12, omega-3, right? The placebo effect is real and it's powerful, and I try to harness that. So they come back to me 4 to 6 weeks after, and they're still not doing very well. Then that's when we talk about amitriptyline, nortriptyline. There's a couple of ones that we have to.
Can you not relate that directly to an adult?
Yeah, I don't treat adults, but I agree, right? I see it too, and yeah, no, absolutely. I think even myself, like, I know all about this, and I used to be able to read 45 minutes at a time, and now after like 10 minutes of reading, I'm kind of like looking out the window because my brain has been conditioned to need a level of stimulation from my phone that the real world will never give us, right? And it's scary, yeah.
Instead, there's an emerging use of ketamine in conjunction with like psychotherapy.
Yeah.
Is that something
that those are the most refractory cases there too. So again, I'm a pediatrician. I do a lot of mental health stuff. It is coming in the pediatric world in some of those very refractory cases. But to be honest with you, I really think you can, if you do like the 3P approach, so we optimize psychological. So you need to prioritize sleep, eating well, a little bit of mindfulness, low screen time, right, and exercise. You get a good team of allied health professionals, right, helping. And then you should be able to help kids as long as they believe your message and they follow your instruction, which doesn't always happen. You should be ketamine. Like I use a lot of Zoloft, right? Because it's a little bit more dopaminergic, and I find these kids, they're all just dopamine depleted, right? Even like Wellbutrin, right? My God, I never thought I'd be using Wellbutrin in 12, 13-year-olds, but these kids are just gutted. They're exhausted. They would meet diagnostic criteria for chronic fatigue syndrome, which we don't say anymore. But yeah, so ketamine is becoming a tool, but I don't think it has to get there.
When you're starting to like amitriptyline or nortriptyline for patients, are you usually starting with thinking like long-term use of it, or do you wean them off after a certain period of time?
Yeah, so so I use it in kids 8 years of age and older, right? I start at 10 milligrams. I had a kid just yesterday came in, was on just 10 milligrams of amitriptyline for like 6 months, and it wasn't working. And I find that, you need to get every 4 to 7 days, I'll go up by 10 milligrams to a max of 50 to 60 milligrams, right? And so when you're giving somebody amitriptyline, you have to tell them that 150 milligrams, amitriptyline works through sodium and chloride channels. 50, 60 milligrams and below, like we use it, works through histamine. So it's a different medicine at those dosages. So they go home, they Google it, they're gonna see that's an antidepressant. It's not. But what I do is I say, no, let's try to get one step ahead of your headache, right? Teach your brain what it's like not to be, get you back in that green zone. And I like, after about 1 to 2 weeks of being asymptomatic, I try to wean it.
Thank you very much, Christian.